I'm going to start off with giving you an overview of the Epitome capsule. So here it is. It's a small capsule. It is not a drug. It is a device. It has been cleared by the FDA and the European CE. It's drug-free, it's hormone-free, it's stimulant-free. It's not a drug. It's a device. Therefore, it has an incredible safety and tolerability profile, which you're going to see. It integrates seamlessly along with the diet and lifestyle recommendations you're making, and is particularly useful, I believe, in reinforcing a portion control approach. It's a novel technology. It's science-based. It mimics food, but with no absorption, no stimulants, no strict diets. It only promotes appetite control, and we're going to show you how that works. It's a non-drug alternative. It's clinically proven, safe, non-pharmacologic approach to portion control and appetite regulation. It fills a treatment gap. We need approaches for patients who do not qualify for medications with a BMI of 27 or above, because this capsule and device can be used down to a BMI of 25. And it's also good for patients who do not need to experience any drug interactions, because it's not a drug. It's not absorbed. It's not systemic. It's simple to use and it's easy to adhere to. So let's talk about the mechanism of action, and I'm going to get some legal advice and ask my doctor friend Nico to come up here and help me initiate this.
The Epitome Capsule, your weight management lifestyle companion. The Epitome Capsule offers a unique capsule technology that mimics food in the stomach, naturally activating your body's satiety response to help you feel full and curb overeating. How the Epitome Capsule works. Take one Epitome capsule about 30 minutes before lunch and dinner, along with 2 full glasses of water that's around 16 ounces. Once in your stomach, the device inside the capsule absorbs water and gently expands, beginning to mimic the texture of food. As the stomach churns, the expanded capsule presses against the stomach walls, sending signals to your brain that you're already feeling full, even before your meal begins, and continues during your meal. In a natural digestion process, the Epitome device gradually disintegrates after a few hours and is fully digested along with food and clears out of the body. Epitome, the brilliant little weight management capsule.
Yeah, it really is great. So now let's talk about how it actually does its magic. It consists of 2 types of gel. So there's a super absorbent polymer gel that garners water. It increases its particle size by absorbing water, but it's encased in another gel. So the outer gel is a pH-sensitive polymer envelope, and it's stable from a pH of 1 up to 6.5. So in the stomach, what happens is it resists degradation until the pH increases. So it stays in there for a couple of hours, and the triangular shape of it butts against the stomach wall, and it promotes satiety by activating the stomach stretch receptors, which then signal up through the vagus nerve to the brain, and tells the brain the stomach is full. And so it promotes early satiety. It promotes portion control, and that's how it loses weight. So this is a picture of the actual size of the device, and what's important to recognize this is as opposed to other gels that have been developed and failed, this does not have a large gel burden because it's in a polymer shape. It's in a triangle shape. It's a polygon, and so it remains rigid for several hours in the stomach. It's not really increasing the volume of food. It's not a large gel burden that other polymers have had. So it really has very, very few side effects, which you're going to see. Essentially none. It's got the same sort of tolerability profile as a placebo does. So this is how it works. To sum it up, you ingest it with 2 8-ounce glasses of water 30 minutes before your 2 main meals of the day. It expands, the outer polymer dissolves, and the inner polymer absorbs water, and it helps it form that triangular shape. It expands. It starts abutting against the side walls of the stomach. It activates the stretch receptors. After it's been in there a couple of hours, the outer polymer starts to become squishy, and it passes through the duodenum, and in the intestine, it totally dissolves because the pH is higher. It goes away. It goes out of the intestines naturally. So when is it indicated? This is what the label says. It's indicated as an aid in weight management in patients with overweight and obesity. The body mass index can be 25 to 40, and it's used in conjunction with diet and exercise. Okay, so who is a good candidate for the epitome capsule? Well, essentially anyone with a BMI of 25 to 40 who's an adult who needs to lose weight to feel better and to be healthier, um, uh, by using a non-absorbed device that promotes satiety and helps them enforce their intentions to follow a better diet and lifestyle program. So it's particularly effective, I believe, for individuals who struggle with portion control and who do not stop eating. I have friends that I go out to lunch with, and they just seem to keep eating, keep eating, keep eating. I have to stop after a while, and so I think that's an eating pattern that is associated with obesity and is fairly common. So I think that's a good candidate. Another candidate is anybody who has trouble with portion control, because what this is going to do is it's going to give that signal of satiety that's going to occur earlier than it would. It could be used in patients who have GLP-1 intolerance. It could be used after completing a medication-based interventions. And anybody who is struggling with a non-drug and wants a non-drug, non-surgical approach to help them with weight loss. So I also think it could have a special place in individuals who are higher risk because it's not absorbed, it's not systemic, it's not going to interfere with any of the medications that patients are taking. So it's a safe alternative for patients who have higher risk also. Here we go. Here's how the epitome capsule is dosed and used. You want to take it before your two main meals of the day. In my book, that would be lunch and dinner. For some people, it'll be breakfast and dinner. So before your meal, 30 minutes before your meal, you take 2 glasses of water, 2 8-ounce glasses of water, and you take the pill with that water. Then you eat your meal, and voila, you're eating a smaller portion. So it's very important for prescribers of this that you monitor patients, make sure they understand how the medication works. Because they understand how the medication works, they will incorporate it into your lifestyle recommendations.